Good afternoon. Today we are going to do a lesson. FYI, I used to be a teacher, semi-decent teacher for about 10 years. I haven't taught in about 2 years because of this kidney disease. So we're going to call today's episode a lesson on preparation for dialysis. So we're going to go over all the prep work needed in order to get access to the machine to run a session. Now I run 4 days a week, Monday, Tuesday, Thursday, Fridays. A lot of time people run 3 days a week. It just depends on the severity of whatever disease or condition they have concerning their kidneys. So let's get started. Lidocaine. So what this does is I'm going to put it on my arm, and it helps with the prevention of pain when I insert the needles. Lidocaine's a numbing agent, so what it will do is it'll numb the arm. It takes about an hour for it to take effect, so that's why I put it on first thing before I get ready to get everything else ready in the other room. It takes just a little bit, but I tend to overdo it. Needles, pain, I just rather not have to feel it. All that area will become numb in about an hour. Then we take saran wrap, cling wrap, and we're going to wrap it over the lidocaine. Somehow this helps accelerate the numbing process. The first step in the process of getting ready for dialysis is complete. What I refer to as my dialysis room. This is where I have all my equipment, all my supplies, things I need in order to literally stay alive. So first thing we're going to do is get the machine turned on. We open it up, turn it on. Now 24 hours beforehand, what I do is I create what's called a batch. And the batch is in this box below. This is the medicine that pumps into my arm to help with my kidneys. Fun fact, so when I'm on the machine, I believe it's every 10 minutes, my entire volume of blood in my body is pumped out into this machine. And what the machine does is pumps the blood through this, a cartridge, then back into my body. This here is my artificial kidney. Inside are thousands and thousands of small filters, and as the blood goes through those filters, it cleans it out and puts it back into my body. Everything is color coded. I'm gonna make sure everything's on tight. I'm gonna detangle all these wires. I need 2 bags of saline, body, and then I use it also in case I get cramps or if I get too lightheaded or my blood pressure drops. I can pump in the saline pretty quick into my system and it helps alleviate some of that pain. There's one bag that we'll get to in a bit. This bag we're going to use right away. Let me turn it on. We have the machine turned on, and it's going to take about 23 minutes in order for it to get ready for the next step. So we're waiting the 23 minutes. We're going to check the medication inside the bottom of the machine. Okay, we're going to check the medication that I need to make sure that that is clean, because as this pumps through my body, I got to test the pH level and other things like that. If it's not clean, I mean, it will literally kill me. We're going to enter some information into our tablet. This is so the nurses at the kidney center will have access to all my different vitals, my blood pressure, the rate of adding of the fluids, all kinds of stuff. I just got to keep track of everything, every session. There's quite a bit to keep track of. If you hear that, that means that the liquid, the medicine actually in this cup is now ready for me to test the pH on. So I'm going to take this, I'm going to insert it, and I'm going to stir it for about a minute. Again, if it's not good to use, and I put it into my system, It's a good night, Nathan. Stir, stir, stir. We're waiting. A little side note. On a personal note, my girlfriend and I broke up last night. So if anyone, you know, kind of bad timing, right? This illness and relationship really don't go hand in hand at all. Makes it really difficult. But it's okay. For most people, life goes on. Okay, so we're gonna check. As you can see, I got that yellow there. Match it up with the chart on top. It matches. We're good. We tested the liquid, the medicine is good to go. The saline bags are hooked up. We got about 17 minutes left before I can go back to that machine again. So while we're waiting for the machine to prime and get ready, we're gonna get all our supplies out. Blue liquid pads. They're to help soak up the blood if there's a lot of bleeding, which happens periodically. Tape. We're gonna need 15 pieces of tape. It's definitely not fun and games. Man, tiredness when you're done. Some days you're just done for the whole day. It's just exhausted. You're exhausted. Even though you're not doing anything, you're just sitting in that chair. Your body is just, it's like you ran a marathon. It's just so hard some days. Think straight. Your mind's all messed up. It's just a mess. And alcohol wipes. And these are called hemo clips. They keep the blood lines attached together so they don't fall apart. Yesterday we talked about the red sense. This is the red sense right here. Just goes right inside there. And then you wait for the beeping to stop. It's ready to go. 2 gloves, one for getting on the machine, one for getting off. We're going to have 5 of these 10 milliliter syringes. 1, 2, 3, 4. And I was wrong. 6. We need 6 syringes. 5, 6. We have a 10 milliliter syringe with needle, and this will be what we use for the heparin. Heparin, these little bottles right here. This again is what keeps the blood from clotting, because I'm doing dialysis. You want all the blood to flow constantly. If it clots, once again, you're a goner. Okay, so we get the cotton swab ready, got all the syringes out. Next thing what we're going to do is we want to go ahead and fill up our syringe with the heparin. With the needle, I use 7,000 milliliters each time. When we were younger, my grandfather was on dialysis, and my brother and I would take these needles my grandma had in the house, and we would fill them up with Kool-Aid, and we would go around squirting each other with Kool-Aid out of the needles. It probably wasn't the brightest or most sanitary thing to do. This is a genetic disease, by the way. It's not like I caught it. It was given to me by my mother, and then my grandfather gave it to my mother. So it goes down the family history. And I hope it stops with me so my children, my kids don't have to get it. But we'll see as they get older, because it progresses with time. Everything's laid out on the table, so everything is good there that we need. We'll take some vitals. Perfect, 98.7. Now I'm just going to enter it into the information for the nurses, which, by the way, at the Fresenius Kidney Care Center in Midtown, best nurses in the world. They're so wonderful. Every one of them, every single one is a wonderful human being. They're angels. They truly are. This is a cuff for blood pressure. We have to take it constantly throughout, every 30 minutes during treatment and then before and after treatment, because what the machine does is as my blood is leaving my body, my blood pressure drops, and sometimes it drops dangerously low. So we got to keep an eye on it. If I get tired all of a sudden, or I just don't feel right, dizzy, I got to take means to get my blood pressure back up. But first, let's check it sitting down, and then we'll check it standing up. Okay, so my sitting is a little bit worrisome. It's 128 over 86, but my pulse, which has been running high, is right now at 121 beats per minute while I'm sitting down relaxed. So they are scheduling me to go see a cardiologist because the leading cause of death for dialysis patients is heart attacks because of the pressure the fluid intake and outtake puts on your heart. A lot of people die from heart attacks. It is what it is. Okay, so standing, not much better. 146 over 85 with a pulse rate of 124 beats per minute, which is quite alarming, to say the least. But we're going to push on through. Go wait. I have lost almost 40 pounds within the last 2 to 3 months, primarily because of some medication they got me on, which is good because my kidneys are enormously large. They're larger than footballs. Okay, so we're going to weigh ourselves. Okay, 98.1, and that's in kilograms. Okay, here's the machine. You'll see we got 1 minute left. Okay, you hear the machine going off. It's telling me it's time to get this ready. Okay, so to get the machine ready, first we're going to make sure you get all the air bubbles out of these lines. If the air bubbles get into your body, no bueno, not very good. Then we're going to take our artificial kidney and we're going to detach it from the machine. We're going to get all the air out of those lines. And the best way to get the air out is just to shake it up, pound on it a little bit. Okay, now we're going to start getting some things ready on the machine. First thing we want to do is make sure all the lines are connected and untwisted. And I got to enter the parameters. It's all determined by your weight. It'll be about 3.5 hours on the machine. You can guess what the yellow line is for. What else comes out of your body that is yellow? If you guess urine or pee-pee, you're correct. One last step. Get a couple syringes filled up with saline because I'll need them throughout the process. Okay, we are ready to go. Everything's been prepped, everything's been prepared. It's taken about an hour. As you can see, my arm is white. When the lidocaine, that means it's numb and ready to have the needles injected into it. I'd much rather be out and about with everybody else, teaching, working, making money, but I get pretty isolated here in the house. This has kind of taken over my life for the last 1.5 years, almost 2 years. So hopefully sooner or later, one way or the other, it'll be over with, and then we can move on. Any questions, comments, please put a message below. Otherwise, I hope you have a fantastic weekend. Bye. Home dialysis. There's a tourniquet. These are the needles. Pretty large needle. We're going to use 2 of these. This is called the flash. You see it pulsing? That means I got a good stick. I gotta test it to make sure everything's good. No pain. One of the most difficult things is everything I do, I have to do with one hand. Just flushing it with saline to make sure it's clean. If it bleeds like continually, and people have bled out before, got about a minute to stop it before you're a goner. The next one is the tricky one that bleeds the most. Once again, this is a needle we're using today. Pretty good sized needle. It's a tricky one. It's the one that hurts the most. You're gonna stop seeing. This one bled a little bit, so gotta test it. Make sure. Just so you know, this does suck quite a bit. And that's the stick. Next, we're gonna hook up to the machine, but I can show you that next time. Have a great day. Talk to y'all later. Bye. So we are now done with dialysis. I've disconnected from the machine and I've flushed saline back into my veins. And so now we're going to take the needles out of my arm and we will be done. So sometimes this can be a little messy. I've done it for over a year now. We're going to take off the tape. Then we're going to take off, this is called a red sense. It's a sensor that detects any leaks of blood. So if I'm on dialysis and it starts bleeding outside the needle, this will set off an alarm. So we have your venous needle, and we have your arterial needle down here. We're going to take out the venous first, and then after we let it clot, then we'll take out the arterial. That holds the needle in, just like so. Now here's where I have to be careful. This is a needle guard up close to the needle, so when it comes out, it's super sharp. When it comes out of my arm, it doesn't poke me, scratch me, cause me to bleed in another spot. Needle guards in place, gauze to stop the bleeding. I'm going to yank on this with my left hand. It'll pull out the needle. Then I'll place the gauze on the spot where it is bleeding, and we'll hold it for 10 minutes. Here we go. Okay, pretty good. A little squirt of blood, not too bad. So I'm going to put it on for 10 minutes. Okay, so it's been about 10 minutes, and we're going to release the pressure, and we're going to see if we can put a bandage on it. Who knows this quote? No one makes me bleed my own blood. Gauze, tape, slowly remove it, and it has stopped bleeding. It bled a little bit. So we're going to put the gauze on it, tape it up. So next, this is the one that will, if it's going to bleed a lot, and I've had a mess all over the place, this is the one, the arterial vein. I got the syringe in my left hand that I'm going to pull it out with. I got the gauze right here next to me. The first one is going to reveal the needle. The second one is going to expose the needle. Be very careful at this point. I'm going to slide the needle protector up on top of the needle itself. Same thing, we're going to yank it out with my left hand. My right hand is going to apply the gauze to the site where the needle was inserted. Hopefully there won't be no blood. 1. Then we'll wait 10 minutes. 2, 3. Okay, so really got to put a lot of pressure on it because this one's a squirter. 10 minutes, and then we will see if we can continue. Okay, we're just about at 10 minutes. Just a couple quick insights to dialysis. One, you have to pay attention visually, because if it does bleed, and it bleeds quick and a lot, it doesn't hurt, but you'll feel warmth, the blood from inside your body, but that's about it. So you really got to keep an eye on it. And two, one of the great parts about dialysis is I'm wearing this hat because it causes all your hair to fall out. But we're going to go ahead and check to see if it's ready to bandage up. So I'm taking off the pressure. I'm going to put the needle I have been holding in my hand over here. Got me some gauze. Going to get some tape ready. We're going to peel it back. We're going to see that it did clot up. I do take heparin of it before each session, which helps helps keep the blood from clotting so it flows. But then by the end of treatment, about 3.5 hours, it starts to clot up again, which is what we want. So there you go. On the machine, off the machine, in one day. Any questions, please let me know. We'll talk to you later.